Lymphedema might come into play when there's been a true traumatic event that influences the flow of our lymphatic fluid. And what happens is we have an accumulation of proteins in our tissue space, and it causes that swelling to occur. And unfortunately, when there's been an injury or a trauma, it doesn't improve on its own. Lymphedema might develop anywhere within our body, but most commonly we see that in our arms or our legs. It can also occur and be present in our head, face, and neck, and in our trunk as well. Oftentimes, lymphedema occurs if our swelling persists for greater than 6 months. What happens is swelling occurs and it puts pressure on our tissues, on our nerves, and it can cause symptoms including weakness, numbness, tingling in our extremities, limited range of motion, and a decrease in the functional use of our body. Once lymphedema sets in, unfortunately, there isn't a true cure to improve upon that. The gold standard of treatment right now is complete decongestive therapy to help mobilize and contain that fluid and hopefully reduce the size of an individual's limb. In our clinic, our goal is to see people twice a week for about 90-minute sessions if that's feasible. The timeline varies from one person to another. For some, it may just be a handful of weeks, and for some, it may be many months to achieve their goals. What a typical treatment session may look like, or does look like, is first of all, we provide extensive education on lymphedema and what to expect during the course of treatment. We do frequent measurements. We want to measure the limb or the extremity to notice any changes and improvements. We provide very specific patient education on how to care for themselves. That involves very meticulous skin care, and monitoring of the skin to make sure we avoid any infection or injury to that body part. We also help the individual relearn or gain independence with their self-care tasks. Specific to lymphedema, we do the manual lymph drainage. It's a very gentle hands-on technique. And what we're doing is we help to decongest or reroute the lymph fluid that's stagnant in that body part to more to healthier parts of the lymphatic system, and so that the system can work more efficiently. That limb, once we do that manual lymph drainage, we want to preserve what has been completed, and we do a compression wrapping. That does involve multiple layers on the limbs. We use padding and gauze, and then finally a compression wrapping that helps to contain that work. The compression wrapping also has a secondary but very important role in the exercise component. We teach the individual tailored exercises and activities that they will do with the wrapping in place to help improve the efficiency of the lymphatic system so that when they leave here, that continues at home. If you or someone you know believes that you may have lymphedema or other swelling that has persisted over an extended period of time, feel free to contact your primary care provider, whoever that may be, and ask them about lymphedema and if that is a concern for you. And all that we would need is a communication and an order from your primary care provider.